Hey there. I'll be very brief. I'm Shawn Stinson. I'm the Vice President for Clinical Quality and Patient Safety at Palmetto Health. And I started in this to get interested in systems work when I was residency program director. I directed a residency program here in internal medicine for 11 years. And I have to tell you, working with the patients that we worked with, and I also had a busy, faculty practice as well, and worked in the hospital a lot. I became very frustrated, as I'm sure many of you are. And I'm very frustrated today as well, and kind of tired. I'm really tired of those slides that we see, that despite the best efforts of everybody in this room and all of our colleagues that are working inpatient, outpatient, throughout our state and throughout our country, that we hurt people. I'm tired of seeing that we're in last or almost last place among developed countries in our health outcomes. I'm really irritated that we're pitted against the people that we serve, our customers, our patients. They're not our customers, they're our patients. They're our partners. And that we end up with a lot of finger pointing. I mean, we all do it, right? We point at, right now we're pointing at Nikki Haley. She's pointing at us. By the way, you're all immoral. Sorry, that was the finger pointing that I'm not supposed to be doing. But just really, really tired of doing what we, each one of us thinks is the best thing to do. Imagine if we all walk out of here today and we all go back and we work on the surgical safety checklist. What great things will be accomplished. Fewer people will die. They will. But we're still going to be faced with the burden of chronic illness, right? I mean, all the things that we're going to be talking about today, we are going to allow people to leave the hospital healthier, but we're not going to do anything with that particular project, which I am completely behind. But we're not going to do anything with that project about reducing the burden of illness in our community. And it's going to take a big grassroots effort to really get people to work together. It's going to take a change in the payment system, right? I mean, if you happen to be an internist that owns a CT scanner or an MRI, if you're really rich, if you're in an MRI, and somebody comes in with back pain, you're going to do an MRI, whether they need it or not. Why? Because Laura will pay you. Finger pointing, Laura. Imagine though the system that could be developed where we could actually spend less money to do a better job. That system exists, by the way, and I'm not a socialist or a communist, but that system exists throughout the world in different places. We do a fantastic job at what we're reimbursed to do. So one of the things that I'm going to be really pushing for, along with my colleagues, is to help to change that part of the system where we're paid to help people be healthy and where the patients take part in it as a partner. So that was my last finger point, the Haley jab. That was the last one. If you ever hear me do it again, you're entitled to do a dope slap on the back of my head. But we need you. We need for you to go back to your communities. And we're going to be calling on a lot of you over the next few months to really start those snowflakes here in Columbia, but then across the state. And I look forward to working with each of you. Thank you.